Now here, see this, so very well seen. Depth come karo. Gluteus and piriformis, two muscles seen very well. Gluteus, do one thing, label it so that it's clear for everybody. Freeze. That is gluteus maximus. And this is piriformis. PI. Online people, you are seeing it. Is it clear to you people?
Yes, Lakshmi.
Yeah, okay. Now I will unfreeze. Save and unfreeze. Sciatic also we could try to see, but I am not so interested in the sciatic as in showing you the muscles. Sciatic will be there, of course. See, follow this, follow this. There is your sciatic.
Oh, that one.
Okay?
Oh, yeah.
That down below.
Yeah.
Okay? If I come below this, probably I can see the gemelli and others. Yeah, there is the. You can see instead of one, there are two muscles there now.
Biceps.
See, freeze that. You can see the three muscles there. These three. No, it's you have to move the cursor a little. No, okay, I'll show it again. That is better. Please see this depth. Can you see one muscle there nicely? The piriformis is seen well. Gluteus is seen well. One nice big black. Okay, okay. And as I come down, that's your sciatic probably, where her, yeah, there, that. And let us see. Here is your, see the gluteus is still there, the three muscles. Freeze this. There, go there. Take your cursor there, below that, below that. No, this side, this side, this side. There, come down. That would be one of your slips of muscles, gemelli. I am here. Please see this. Okay? And let me, somebody wanted sciatic. We can see sciatic also. See, sciatic is usually, it's best to trace it from the ischial tuberosity and the greater trochanter, that place. Can you see the two bones there? In between will be the depth increase karo. So somewhere here should be the sciatic. So in this place, if I do this, there, the dense below, go down below, there, that's a dense. Can you see that line which is going? Yeah, that two white lines, that is the one. So now that's the gluteus. In fact, he's so thin I could use the other probe, but it'll let me, this has a big surface area. For those who wish to see depth, come kar do. This is the sacrum. Depth come karo, come karo, come karo. Oh, that's the minimum. So I'll show you the sacral hiatus. There is your sacral hiatus. Okay? That is your sacrum, and that's your, where her arrow is the sacrococcygeal ligament. And if I want to give caudal, I would have to give here, I think high frequency probe you need for this. Anyway, that apart. So, see, here is your posterior superior iliac spine. See the one coming up here, that is your posterior superior iliac spine. That. Okay? lateral to that is all gluteus maximus. Okay? And as you come down, see, here there is only gluteus, there is no piriformis. As I come down, piriformis will make its appearance. See this?
Oh, wow.
It's coming there. 2 muscles it becomes. The same thing as I go up, there is no second muscle. I am here at the, and as I come here, here is your, see, this freeze. The darker muscle below is the gluteus minimus. Go there. G min, that is gluteus minimus. G min. The dark one is the gluteus minimus. Above that is the gluteus medius. The whole thing. In this corner, there is no gluteus maximus. Okay? It is all here. So as I said, there are fibers which are arising from the iliac crest, which go like this. And then there are fibers which are coming like this from the sacrum. So there are 2 types of fibers here. So you have to put a needle like this for these and a needle like this for this. And then of course you come here and put the needles for the piriformis. And if you come down here below, it will be the gemelli. This will be the way to do these
needling of these muscles.
Any questions?
Could you show
Hello.
side joint?
Yes, I do. But I cannot show you with this. Yeah, I need a higher frequency. Yeah.
Lakshmi, one doubt.
Yes,
The
please.
gluteus medius, you has the vertical and the horizontal part. So for the horizontal part, you put a needle vertically.
Yeah.
And for the vertical part, you put it horizontally. What do you mean by horizontal?
Like
What do
this.
you mean by horizontal?
Like this. Can you
Like
see?
that?
Yeah.
In plane with the ground. In plane with the ground.
Yes, parallel to the ground. Both are parallel to the ground only. This is like this and this is like this. Call it sagittal and coronal.
Okay. So you go in coronal plane for the vertical one, right?
Yes. See, when you do this, you're catching the maximum number of fibers. When you go like this, you get the maximum number in depth. But the muscle itself, you get the maximum recruitment to the needle when you do like this. Did. Yeah.
मोबाईल आहे तुमच्या पॉकेटमध्ये
आहे ना
मी काढून घेतो मोबाईल
काय झालं
मोबाईल आहे
मोबाईल नाही आहे
नाही
ना
ना?
नाही that time you said I have given off the mobile. I don't know where it is also. So with this other probe I'll show you caudal also. See here, this is so much better seen. It's a pleasure to come to high frequency probe. See, this is your actually the multifidus at this level. This is the sacral spine and this is the multifidus. See, it's disappearing now. Multifidus is disappearing. Okay? As I come here, the multifidus is becoming thicker, 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 and now spinalis is also making its appearance. Okay? As I go, it's becoming bulkier. Can you see how much bulky it becomes? This is, I'm coming to the L5. This is L5. This is S1. काय थंडी वाजते का रे बंद कर ना AC बंद कर थोड़ा वेळ okay now as you go down you can see one sacral spine, the lower one. Now probably can you see 2 of them coming? There you have the sacral cornua. That upper line is the sacrococcygeal ligament. That is the sacrococcygeal ligament. Okay? And the same thing, if I show you in the vertical direction, it will be very well seen. There. Freeze. That is the sacrococcygeal ligament. Show that that is the sacrococcygeal ligament, which has to be penetrated for entering the caudal space. Okay? That is that. Now, SI joint, you follow the sacrum laterally. Very well seen sacrum here. Okay. Is that clear? Sacrum. And now I am coming laterally. Here is your SI joint. There. There's a definite gap there. Okay. Sacrococcygeal joint, SI joint, is actually at the lower end. So somewhere here will be the joint. See, the two bones are still seen. They will disappear now. See, the ilium has disappeared. Sacrum is there, but ilium is gone. So now when the other bone comes, it will be here. Having said that, I would think, sorry, yeah, that's the joint. No, that's not the joint. See, here is your sacrum. Okay, sacrum, unequivocal sacrum. Ilium.
This is the idea.
Ilium. And come to the end. This is gone.
That's the parent.
Yeah. Somewhere here it should, see, here is your PSIS, posterior superior iliac spine. If I go here, this is your sacrum there, PSIS. So you keep following that down. Follow it down, down, down. Towards the lower end. See, somewhere here will be the joint. In my opinion, fluoro is a better way to find the joint, because you can see the dye spread. Here it's easy to make mistakes. You can see all this and you can direct your needle through it, but it is always better to confirm with the fluoro. Okay? Okay.
Yeah, I already answered the question.
Ah.
Fluoroscopy or USG guided block is better for SI joint arthro.
Yes, I feel that fluoro is better for this. I always confirm with fluoro for SI joint. And also even for caudal, I pass the needle under vision, but still I will confirm with a fluoro once. Because what you see on USG sometimes can be misleading. And you may be, see, when you are putting in a needle, you think you are here. Yeah, you are able to see. You will see the nice line and get in here. You think you have gotten here, but your tip might have gone there. You come through this, but you have slipped out there. This will not be seen so very well with ultrasound. Whereas if you take a lateral view of the sacrum, you can see very well that the needle is entering here. So this is why I always confirm with the fluoroscopy. But it becomes very easy if you have ultrasound to enter the caudal space. It's actually not even a 5-minute job.
For pediatric caudal, madam, USG.
You don't need anything. You don't need anything for a pediatric caudal. It is there. It is saying good morning to you. Adult caudals are more difficult. See, most blocks in children are easy. And there is no obesity. There are no curvatures. So, and also the other advantage in children is the facial layers are very thin. So even if you are a little away, let us say 1 centimeter, 2 centimeter away, the local anesthetic will just go through. Whereas in adults, the connective tissues are organized and they don't allow. The compartmentalization is a much more pronounced thing. Now, since I have got this probe, I will just show you again the gluteus and piriformis, and if possible gemelli, because gemelli may be better seen with this.
Dr. Vasudha says please show sacral foramen.
Sacral, okay. Sacral foramen, a little difficult. See, this is the, no, this is not L5, this is sacrum still. Sacrum, 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 sacrum. This also is sacrum. Can you see the shape?
How do we do
This is your L5.
Yeah.
Okay. If you want, you can see it like this. Then that will show you L5 very well. I will come here. Yeah. Okay. Follow this, follow this. You have to find a dip. This is mostly the sacrum.
Straight up.
Yeah. And this is a full sacrum only. Okay. So this is still sacrum, I believe. This is the L5. This L5. This is probably L5 S1. The in between. Yeah. That is S1 L5. And so here I will take it like, see, this is typically obviously S1. Here probably is your sacral foramen. Here. Freeze this. Go there. Depth kam kar do. Unfreeze. Depth kam kar. Yeah. Freeze. Probably there is a gap there. This is there. Dip. That would be the S1 foramen. And it's again, these are better seen with fluoroscopy. Unfreeze. So we are supposed to be doing muscle anatomy, not bone anatomy. Okay. So now this is the edge here, and so it has to be here. There actually you are seeing it, gap. Now that is the SI. Come this side. Come a little this side. This side, this side. There. That is the gap. That is probably S1. And as I go down, another will come. That is probably the S2. S3 maybe. So anyway, let's not go there. I would just want to show you the piriformis depth. Depth. See, here is your piriformis and this thing very well seen. Piriformis, okay. And as I come down, see the two muscles there. One and down below another one. Yeah. And increase the depth. Can you see? Two muscles. Whereas when I come here, it's one single muscle there. Yeah? Okay, and I'll also show you this. The gluteus medius and minimus. These are very well seen. Okay, lower limb now. Any questions you can ask, and we'll be changing his position so that he comes into the camera range.
Yeah, thanks.
Any questions you can ask.
We gave a caudal for spinal surgeries.
डोकं त्या साईडला करणं.
आपण टेबल थोडंसं शिफ्ट करायचं towards
That is enough. Oh, that's good.
Yeah, like I give a caudal for spine surgeries, madam. So in case, can we do a USG guided caudal for spine surgeries there?
Yeah.
So like the probe you were holding, that should
Vertigo na.
be the probe like
Take
you
care.
were holding. It should be in plane or
It should always be in plane.
in plane.
Then only you can see the whole needle entering. No?